Workability is an integrated quality assurance system for healthcare practitioners to provide the same high standard and quality of care to all patients across South Africa. Workability's procedural, operational, and support systems enable physiotherapists and occupational therapists to provide quality-assured care and cost-effective interventions in line with international evidence-based guidelines. Our solution links together key stakeholders including the medical team, employees, employers, and funders to streamline the injury management, return to work, return to life, and disability management process.
I'm a physiotherapist and I've been in practice for many years. I've treated many different types of patients, different situations, and what's been glaringly obvious is in South Africa, the patient pathway is very haphazard. Patients could be referred for physio, maybe they go straight to specialist level and never referred to physio. And what we find is there's typically very poor communication between these different stakeholders, which all adds to the haphazard pathway. Clinical guidelines that have been proven internationally are very seldom used in South Africa.
By educating and supporting all stakeholders to follow clinical guidelines, the funders spend on unnecessary investigations like radiology, hospitalization, and surgery can be dramatically reduced. Employees would have less time out of work, less medical costs, and would return to life roles sooner. Employers would have greater staff retention, less time off work, and greater productivity. Workability's operational support and processes enable the network therapists to work within evidence-based clinical care pathways and a stratified rehabilitation approach to ensure that the correct patient is getting the correct treatment at the correct time. From simple reassurance and functional rehabilitation to psychologically informed rehabilitation to address long-term disability risks, each and every patient is assessed in their own merits and is provided with a tailored and specific rehabilitation return-to-life plan. All independent practices and therapists utilize the Workability IT system, which enables therapists to capture their assessments, generate reports, manage their diaries, and complete their billing and invoicing. Our IT system creates a universal medical record which is tailored to the various stakeholders to ensure that all parties have access to the same relevant information and are striving towards common intervention goals. Workability contracts quality assurance managers who use the IT system to review therapists' compliance with evidence-based clinical pathways and adherence with procedures to ensure consistent and successful outcomes of assessment and treatment interventions. Through Workability's training program, all therapists engage in a variety of core group training sessions and self-paced e-learning programs, which ensures that therapists are current in clinical knowledge and research outcomes. Workability supports the application of this theoretical knowledge through mentorship of the therapists and continual feedback via the IT system and reporting methods. Workability's vision is to provide an integrated solution for healthcare practitioners and return-to-work, return-to-life stakeholders to provide the same high standard and quality care to all patients on a national level. Return to work, return to life.